And it affects me because when you incarcerating youth, you putting their esteem down. If they want to grow up to be something, then that's not going to help them at all. Like, you have to help them, not incarcerate them at all.
So when most people think about public safety, they think about the courts, corrections, and police. In actuality, public safety is so much more than that. It encompasses other collaborative agencies, social service agencies that really help to, prevent youth or adults from entering the justice system.
One of the things that the child welfare system should not be is taking the place of a family. It should be a temporary intervention with a long-term vision for the child and the family and the whole community.
That there is a connection between these two systems, between the child welfare system and the juvenile justice system. And really, the child welfare system can offer, particularly for those young people who are involved in it, can offer the first real source of support and investment in their lives and their family lives that can decrease those factors which we know increase the likelihood of involvement in the juvenile justice system.
One of these risk factors is family and neighborhood poverty, which is one of the strongest predictors of child welfare involvement, and we see that in Ward 8, which has the highest number of cases of substantiated abuse and neglect, also having the highest unemployment rate in the city, and having the highest child poverty rate in the city, where 1 in 2 youth, over 50% of youth in Ward 8 are under the poverty line, and so 670.
Some of the other social systems that we are addressing in our briefs, especially in mindful of the consequences, we're seeing that many of them are coming from areas that have high risk factors for trauma. So not only are they at risk for trauma as a result of being involved in the foster care system, they also may have trauma from the circumstances that led to their involvement in the child welfare system.
In the education brief that DC did, what we saw was that educational attainment was lowest in Wards 7 and 8 in the district. To give some perspective on that, the district average for people who have achieved a bachelor's degree or higher is around 47%. But for those from Ward 8, it's 10%. That's 37 percentage points lower than the district average. And what we know about the role that education plays in leading to the justice system, you hear a lot about the school to prison pipeline and school push out and all these factors, and so a lot of research has shown that there is a link between having a robust education system and helping to divert youth from the justice system.
There are a lot of public safety benefits in investing in employment for young people in DC. And they correspond a lot with what we know about evidence-based juvenile delinquency prevention programs, in that they connect young people socially, culturally, and economically to their communities. And when they're connected in these ways, they're less likely to become involved in the justice system. On the other hand, when we focus on justice system responses to unwanted behavior from young people, it sets them apart from their communities. And it sort of does away with all of those positive social and cultural and economic benefits that we get from employment.
One of the things that we are promoting with the Department of Mental Health and other social service agencies that work with DC youth are to incorporate mental health in all policies, so that the policy they develop for child welfare, for education, for the police department and so forth would be mindful of mental health needs of youth, and that would then help with these issues as they are going through these other systems.
One of the things that the child welfare system provides, or should provide, both here in the district and nationwide, is an intervention strategy, one that allows social service agencies and the child welfare system to intervene when families are not able to meet those needs of the children and work with the families to help improve conditions. And yes, if situations are extreme enough to remove children from abuseful and neglectful environments, but ultimately it should be focused on reunification of the family, keeping the family together, and really helping to build positive life outcomes not only for the youth, but also for the parents and the families as a whole.
Nurse-family partnerships is an evidence-based program which has shown to not only have some significant effects on early childhood development and the relationships between mothers and their children and intra-family relations, but also returns a significant, provides a significant amount of return on the initial investment in that program. Nurse-family partnerships really pairs mothers with a nurse who does in-home visits and provides in-home support. And what evidence has shown is that this program does a number of things. It decreases the amount of abuse and neglect cases that come into the child welfare system. So anytime we talk about these systems, closing the front door is really the most important thing. Prevention is really, an ounce of prevention really is worth a pound of cure.
You have to look at more than just DYRS and what they're doing within the district, because they're not solely responsible for our youth.
The child welfare system can't function optimally without the support of effective education systems, employment opportunities, and a mental health and physical health system. And so it's really important that all of these systems are given the necessary resources and are practicing the best models in order to support the short-term and long-term health and safety and well-being needs of youth and families in the district.
Early investment in young people through the child welfare system can have a positive effect on public safety, an effect on decreased spending at the juvenile justice system level, and a decreased reliance on using the criminal justice system to kind of correct these behaviors of young people, to kind of go back over that landscape that could have been taken care of by more therapeutic approaches earlier on.
My hope is that this series of briefs really help to educate not only the general public, but really policymakers here in DC, and get them thinking about what the juvenile justice system should look like. And not just the justice system, but what investments for our youth in the district should look like.